So we'll move on to Maisie, who's the commercial executive at Promatica Digital. This is a supplier that's again based in Leeds on our doorstep. They have a number of products, but today Maisie's going to be talking through her Social RX product, which is a digital social prescribing platform. You're okay there, Maisie?
Yep, thank you, Tim. I'm just going to share my screen. So, hello everyone, my name is Maisie. I am commercial executive at Promatica Digital, but the reason why we're in the program, the Propel program, and what I wanted to show you today is our social prescribing tool, Social RX. So for those of you who don't know what social prescribing is, I'll just give you a quick overview. Currently in the UK, 1 in 4 GP appointments are for non-clinical issues. This could be things like loneliness, housing, or financial concerns. Instead of prescribing these patients with something in a tube or a bottle, GPs can refer them to a link worker who works with the patient to find out what matters to them and what services are available that could help them improve their well-being. Things like lunch clubs, counselling, support groups, and these are all based in the community. The problem at the moment is that social prescribing is getting a lot of traction over the past few years, but with all the new link workers that have been hired, they're using Excel spreadsheets to manage their cases. They have a lot of admin work to do with contacting community providers and managing their cases. And also they're struggling to prove the benefits of what they're doing. Without a lack of data, obviously it's hard to get the funding. So what Social RX is an award-winning social prescribing case management software tool that allows link workers to better manage their cases and make referrals directly to community providers with our internal directory of services. It allows GPs to make direct and simple referrals straight into social prescribing, and also self-referrals can come in, or third-party professional referrals, so things like social care, ambulance services can make referrals as well. Also in Social RX, we allow access to dashboards and reports with insightful information into programs, such as how well the program is doing at improving well-being, which services are being used the most, the reasons as to why people are being referred in, and that can allow programs to make improvements and spot where there might be gaps in their service. And also we allow the community providers themselves to log into Social RX and manage their referrals and provide updates to the social prescribing team, and that allows it to be a full end-to-end service for social prescribing. That's just a quick overview. I'm now going to go into Social RX so you can see. So here it is. It's completely web-based. So referrals come in, like I said, through GP. We've got two-way interoperability, which means that a GP has an integrated referral form on the clinical system, so they can click the Social RX button and it auto-populates patient and practice details, and they can send it off. When they do that, that sends an automatic SNOMED code into the clinical system to ensure that every single referral is tracked and counted, which then contributes towards the DES targets for social prescribing. So if a PCN can make 12 referrals into social prescribing per 1,000 patients, they're eligible for £4,000. Like I said, the other method, you can do self-referrals, which means that the patients don't even have to go to the GP in the first place. So we're helping to reduce the overburden on the GP services, and also third-party referrals as well. So all of these referrals come into the caseload dashboard here, where they can be picked up by the link worker team. They can be assigned if a manager assigns different cases, or you can pick up cases as a link worker. So I'm going to go into John Smith's case here. So as you can see in the centre here, this is the whole referral pathway from receiving the referral details all the way to the discharge at the end, so you can see exactly what you've got to do, and it's a nice pathway to follow. At the top, we've got all the key details for that patient, including their contact details, and also we've got this tagging functionality as well, whereby you can tag cases with anything you want to set as a customer. You can set any sort of tags. So for example, it could be a vaccination status, whether they require a home visit, their housing status, and you can report on those tags and search by those tags so that you can see exactly what you can report on, exactly what you want to in this as well. So if we have a look at the referral details here, this is where the information is pushed through from the referral. If there are any risks in here, they will get flagged at the top here, just so that they're easily accessible, and you can add any more if they pop up over time. So let's say you've made initial contact with the patient, you can then collect equal opportunities data with them, and you can capture consent as well. At the point at which you accept or reject the patient, that again sends a second SNOMED code into the GP clinical system to let them know whether they've been accepted or rejected. We're currently integrated with EMIS, Web and System 1, but we are looking to do further integrations such as with Vision or Liquid Logic, which is social care. So if I move on to the second part here, which is scheduling an appointment. So we can go on to add activity. Let's say we've got a face-to-face meeting, 3 PM. You can put in your scheduled date and time in there. And you can also send a calendar reminder to yourself. So all those meetings can be scheduled down here. You've got the communication notes where you can add the whole history of the social prescribing journey with that patient. And again, they're stored at the top so that they can be viewed easily. The next tab across is the baseline assessment. So we've got a few different templates here. ONS4 is currently one of the assessment templates that the NHS recommends and suggests for social prescribing. But if there were others that a customer uses, we add those in here. So I'll just show you what it looks like. So if I fill in this health and wellbeing prism, so you can fill this in with a patient, click save, and then that presents the results graphically, so you can see where they are on the graph. And if you wanted to, you can export those, print it off. The next section across is the action plan. So this is completely configurable. You can capture exactly what you wanted to capture here. It may be the patient's goals, it may be what the link worker is going to do, what the patient's going to do. So that can be recorded here, saved, and then you've got different versions here as well. We've just added in our new release the ability to add different action plan templates, so that if, say, you wanted to expand the social prescribing program to cover things like weight management, smoking cessation, COVID, long COVID rehabilitation, you could add different plans in there and choose which plan you want to cover with that patient. The conversation records are quite useful for commissioners. So how it works is that you've got a list of themes on the left. Again, that's configurable, whatever themes you wanted to record there. So things, for example, financial concerns, lifestyle issues. So you can select a theme, input any information there, click save, and then that's recorded. Each of these themes are read coded so that as a commissioner or social prescribing manager, you can see which themes are popping up most with your patients. So if you found that most patients are talking about financial concerns, for example, that can maybe help determine where you need more resource or where you need more services available in that area. Obviously, you can't report on communication notes or case notes, so this provides a way of being able to do that, and it just gives you an extra insight into the problems or what your patients are discussing. So moving on to the services section, this is where the link worker can book the patient into a community service, having had maybe a few meetings with them and found exactly what is important to them and what could help them with improving their well-being. So you could either do a quick search, say if you know exactly where you want to refer the patient. That brings up a booking form. You can put a date and time, any notes, select the service that the Age UK offers. If Age UK had a login into Social RX, you could book in the referral and that would send it straight to them. Otherwise, you can just opt for it to send an email to the provider instead. The other type of search we've got is an advanced search. So here you could search by a combination of category, service, so that's the things like the counselling, one-to-one, helplines, things like that, groups. You can also search by postcode. So this could be either your patient's postcode or maybe the social prescribing hub's postcode. And by doing that, you can see where all those services are in relation to that postcode. So you can see the distance from maybe the patient's home, and you can set expectations as to whether getting there is actually achievable. So if you choose this one, again, you've got the booking form there. Select a site, and then that's booked in for the patient there. The providers can add notes to this, so they can add if the patient attended, and they can also add notes about the patient's trip to the service as well. So the next section is for follow-up assessments. This may be 6 weeks after you make that booking. It may be every 2 months. So in here you can fill in add in any number of follow-up meetings, and they will go into a link worker's bucket of scheduled tasks that they need to complete. You can fill in another assessment. So I'll just show you what it looks like when you fill in a second or a third or a fourth assessment. So you can see it's overlaid there with the initial one and the current one, so you can see if there's been any changes and if there've been positive or negative changes in well-being. You can see that really clearly on that graph. So the last section in here, we've got the discharge. So you can fill in an outcome review here with the patient. You can record specific outcomes that may be PIP awarded, hearing aid replaced, started volunteering. That again is a configurable list, so whatever the programme managers wanted to record for social prescribing, they can do that there. And then once you change the status to discharged and select a reason, that sends a final note into the GP system to let them know that the social prescribing is complete. Just to point out as well, throughout the whole journey, the GP can see case notes that are filed back in, they can see assessment scores, and they can see service booking information as well. So it allows the GP to have visibility of what happens in the social prescribing programme, as opposed to just referring them and then never hearing anything again. So this is the complete journey, the pathway of managing a patient. I'm now going to go into my favourite bit, which is the dashboards and reports. So the dashboards are more of a visual representation of the data with charts and graphs, and then the reports are the raw numbers, tabular data. And we've got all these different types as well. We're constantly adding to these, and if there was something that a customer wanted to report on that we don't currently report on, we add those in as well. So I'll just show you a few different types that we've got. So the overview one is self-explanatory. You can see the breakdown of referrals over months. You can see where the majority of those referrals are coming from, and also which job roles are referring in the most. You can apply any filters on the side here, so you could put it by month, by quarter, by year. You could also select a filter by PCN or by individual practice or borough. As well as that, all of these are really easily exportable, so you can either export the whole page to PDF, image or Excel, or if you just wanted this bit, you can expand this, export it and send it off in 10 seconds in an email. So the reason for referral one is really interesting in seeing why people are actually coming into social prescribing. So you can see here we've got a lot of stress or anxiety cases in the demo system, and then you can see the breakdown of all those reasons. You can see it by PCN as well down there. I'll show you this final dashboard here. So this is very popular amongst GPs and commissioners. So if I just put on a filter here, so I've got a bit more data. So I mentioned earlier the social prescribing DES targets. So here in this middle section here, you can see which practices are on target for those DES targets. So it's colour coded, where red means not on target at all, and amber means on target for the lower threshold, which is 8 referrals per 1,000 patients, and then a green one would mean they're on target for the upper threshold of 12 referrals per 1,000 patients. So this section here can allow you to see which practices need to boost their number of referrals if the PCN is going to be eligible for that £4,000. I'll just go into one of our reports. This is the assessment report. A date filter at the top there. So on this report you can see how many cases you've got in Social RX that have completed more than one wellbeing assessment. Out of all those cases, how many have improved in their wellbeing, how many have declined in their wellbeing, and then the overall difference from the first assessment or the initial assessment to the most recent assessment. So this tool here can be really powerful in seeing whether the social prescribing programme is meeting its top KPIs, in that is it actually helping people improve their wellbeing. I've not got it on the demo system, but we do have in the current live version filters on this, so you could see things like whether the reason for referral plays a role in how people's well-being is changing. So for example, if people who've been referred in for loneliness are not improving that much, and then people being referred in for financial concerns are improving more, again, that's something that could help the programme improve and find gaps in funding and resources, and make sure that everyone's being covered. I think that's all of the dashboards and reports that I wanted to show you. As you can see, we've got all different types on here. And yeah, I know I finished a bit early, but I did start a bit early. So I'll stop sharing my screen. Does anyone have any questions on that?
That was great, Maisie. Good insight into your product. So thanks for that. Things that stood out for me was just the ability to manage the social prescribing elements and referrals. Yeah, strong integration into the clinical system. So obviously that's going to streamline the pathway. So that's good. And the dashboards look really impressive as well, especially at that sort of holistical view across practices. So there were the takes that I took from it. I've got a couple of questions similar to Rakib. So what projects are you actively involved with at the moment with your product?
We've currently got 8 different organisations across the country who are using Social RX, and that ranges from PCNs, CCGs, and also the voluntary sector. And they're all giving really good feedback on Social RX. We are hoping to start soon a project with NHS Property Services, who they rent out and do up buildings and locations all across the country to NHS services, and they also do that to social prescribing. So whilst they're just renting out the buildings, they're also managing cases and wanting to report on the social prescribing, how it's going. So we're hoping that if we can work with them, and they seem very keen on working with us, we can help engage different areas to use Social RX and improve the ability to report on what they're doing and improving the benefits.
Yeah, that makes sense. And what are your ambitions for the products, specifically in our region, in the Yorkshire and Humber region?
Yeah, well, we're Leeds based. We work in the city centre, so it would be amazing if we had GP practices, voluntary sector in Leeds using our product. And also we'd love to, I mentioned integrating into social care. So if we were to have Social RX being used across social care as well, and integrating with, I think it's Liquid Logic is the system they use, and also Mosaic, I think. That's definitely an ambition for the short term, to get that integration so that in Yorkshire and Humber they can be using Social RX in social care.
Yeah, that makes sense. And how can people contact you for any follow-up discussions or conversations? We
have our email address, info@socialrx.co.uk, or emailing me, calling me is fine. Tim, will you be sharing out our contact details, or do you want me to post them in the chat?
I'll share them out, yeah, with any request. That's great. Thanks, Maisie.
Thanks everyone for listening and